And just like that, we're live.
All right.
Ray, thank you for joining us on Covered the Podcast.
You bet. Thanks for having me.
Absolutely. Our goal on this podcast is to explain health insurance, and I've been told that you can help us do that. Could you, for our listeners, just give a little bit of background on what you do here for the co-op?
Yeah. So I've been a board member of the co-op for the last 5 years. And the last 2 years, I've been fortunate to be chair of the board of the co-op. So
Great.
I tend to be pretty engaged in
Yeah.
the day-to-day activities that go on here and stay pretty connected with the staff, especially the senior management staff, on things that are happening. And then my job is to kind of lead and direct the activities of the board.
Got it. And can you maybe back up a little bit and describe how did you get involved with the health insurance world in the first place?
Yeah, so, I had been working in the business of health information technology for a number of years. Mm-hmm. And the company that I have, it's called the National Center for Healthcare Informatics. We've always kind of looked at, what are the new technologies, the things that we need to be involved in healthcare. And when I saw this whole movement coming up with the Affordable Care Act around co-ops, it really piqued my interest because, one, I'm really concerned about rural health care. Mm-hmm. And I've always been really concerned about the rising rate of uninsured in this country.
Yeah.
So when I kind of saw the stuff that was happening with the Affordable Care Act, it really piqued my interest. And I said, that's something I'd really love to get involved in. So I kind of watched it just from the sidelines as things were progressing. And then at some point I got a letter or some correspondence saying we're looking for board members for the Montana Health Co-op. And I said, yeah, that's something I want to do. So I threw my name in the hat and was fortunately elected to the board of directors. And it's been really an incredible experience.
Yeah.
I can tell you that when I joined onto the board, I had no idea how complex the healthcare industry or the health insurance industry is.
Yeah.
And for the first year, I was really just swimming in acronyms,
right,
and just trying to figure it all out. But it's been an incredible experience for me.
The complicated nature of health insurance is it can be a lot. And so somebody who's in that world where they haven't quite figured out the acronyms yet, and maybe they haven't quite figured out exactly why is health insurance so expensive or so complicated, and maybe we can touch on the cost side of things. And I know it's a complicated answer, of course, but what are some of the reasons that health insurance is so darn expensive?
I think we're living in a time where everything is more expensive, and if we look at the cost of healthcare across the United States, the cost of healthcare continues to climb year after year after year. And as a result, as an insurance company, we have to be able to respond to that. And we've got to be able to cover claims that come into us. We try to do it in the most cost-effective way we can, but we also kind of are right in the middle of the market, right? Following the market so that we try to be as competitive as we can be. But the reality is healthcare is just incredibly expensive. In the United States, we have an incredibly sophisticated healthcare system. We have some of the best healthcare technologies in the world. We're not the most efficient healthcare industry. Mm-hmm. We have tons of duplication in our healthcare industry, and we don't do everything smart. So there's a lot of added cost in the industry that may not necessarily need to be there, but it's the reality of where we're at. And as a health insurance company, our job is to try to provide the best benefits we can to our members at the best cost that we possibly can. So we kind of know what's going on in the market. We know where costs are, and we try to be as competitive as we can.
It seems like certainly staying competitive. The co-op does exactly that. But it also, and I'd be curious about what you've seen as a board member and as a member yourself, just of how benefits extend beyond just health insurance and helping to file claims and helping to figure out deductibles, but the people side of the co-op. Can you talk a little bit about how that's emphasized maybe at board meetings or in those discussions with the co-op that, okay, here's the spreadsheets, but hey, let's also remember that we exist because of our members. Can you talk a little bit about that and what a potential member might expect or what might be special about the co-op?
Yeah, that's a great question, and it's been a process that's evolved, right? When I first joined the board, we were just getting going, and at that point, we were really focused on just being a company, right? Mm-hmm. Getting dotting all of our I's and crossing our T's and making sure that we were doing things right to be an insurance company in the market. And at that time, we didn't have a tremendous focus in the early years on kind of a lot of benefits that came back to our members. We were just literally trying to get in the business. And over time, and especially the last couple of years, one of the things we've been able to do is just really focus on quality initiatives that benefit our members and that affect our members. And so we have initiatives that we put out there, like whether it's tobacco cessation or obesity programs or whatever, that we have programs that are designed to help keep our members healthy, right? Yeah. But it goes beyond that too. I mean, we're a small organization and we're very member centric. As board of directors, we're the majority of the board are members of the co-op.
That's really cool.
So we get it. I mean, right. I'm a member of the co-op,
yeah.
And so this is my insurance company.
Sure.
And so one of the things that we try to do is reach out to our members as much as we can and have a close relationship with them so that we understand their needs and we can be responsive to their needs. And I think there's been a bunch of things that have happened in the last year that I've seen where there's all these great stories of how we've been able to really help our members in a really special way. There's this whole story about Kayleen Murphy that was just fascinating, and the accident that she had,
sure.
and how with our care team with folks like Cindy O'Leary, that we were able to just provide just this exceptional level of support for her and in the stuff that she was going through.
Yeah.
We had a recent situation where we had a member who had a child that needed some special services, and none of it wasn't covered, and there was a number of people in the organization that just stepped forward and donated money.
Oh, wow.
To help this child out.
Yeah, that is a unique story indeed.
Yeah, and those are things that happen behind the scenes and you don't see it, but I think it really speaks to just how member centric we are, that we care about our members, and you're not going to get that in a big insurance company that.
No.
Yeah. So
powerful stuff. When we think about the co-op and some of the next steps, so you described an evolution. What's next? We've arrived at this place where members are, it is a member focused. These amazing stories are happening, every day with the members. What's next for the co-op? What can people expect in 2020 and beyond?
Yeah. So I think this is an exciting time for us because I think we finally hit that point where we know what we're doing. We're in the business. We're providing good services to our members. And now we're looking at how can we be better at what we do. So we're constantly looking at new quality initiatives that we can put in place that help keep our keep our members healthy. Mm-hmm. And so we're constantly looking at those types of things. We have a much better marketing presence out there. Our staff, our team that's putting all that together has just done a phenomenal job of kind of telling the story of who we are.
Sure.
Through the words we say and the images we use and demonstrating it through the capabilities of the company. Mm-hmm. And so I think there's really some interesting times ahead in terms of where we're going. I can see us on this continued slow trajectory of growth. We're adding new products all the time. We just added a Medicare supplement line to our services. So we're constantly looking at how can we provide the right types of products for our members and products that they need and bring value to their lives.
How does something like the Medicare supplement come to be? Is that, a closed door meeting, or is that, okay, we've heard some feedback and this is something that we need to execute on?
I think it's, the management team coming to the board and saying, here's an opportunity. Mm-hmm. And then just some really robust discussion with our board of directors that have lots of expertise in these areas to say, yeah, this makes sense. And, one of the things we recognized is we have members every year who, through retirement, kind of end up moving out of our plan into Medicare. Mm-hmm. And so why not be able to offer a Medicare supplement program to keep them as a part of our organization and our service network. So
that's great.
So I think that those things, any time we're doing stuff like that, it's a really great discussion between the board of directors and the management team on new products and where we're going as an organization.
Yeah. So you're a member of the co-op.
Mm-hmm.
What advice would you have for somebody that is thinking about joining the co-op but undecided, unsure? They're currently underinsured or potentially uninsured, and they have this list of choices that they're sifting through. What advice might you have for that person, or suggestions?
Yeah, well, for starters, I think that everybody needs to have health insurance. Individually, collectively, as a nation, we need to make sure that our uninsured rate is as low as possible. The more uninsured we have, the more it drives up the cost of care. And so, people really need to be considering that they need to get some level of insurance. Mm-hmm. Then they have to pick between a myriad of companies that are out there offering products, right? And as they're comparing products, I think one of the things I can tell them is that, as a member myself and having used this health insurance now for 5 years, MHC does a great job. And I go back to what I kept talking about, that this is really a member-centric organization where we really care about our members and want to make sure that we're not only thinking about just covering their claims and doing those things, but we're also thinking about their wellness and putting programs in place for kind of more longer term care, keeping them healthy.
Sure.
One of the experiences I just had that was really exceptional was one of the things that we offer is kind of a healthy home visit, where a nurse practitioner will come into your home as a member and do a health home assessment.
Oh, wow.
It's an hour-long assessment and health assessment, and it's really designed to really give you an opportunity to spend some time with a healthcare practitioner to really evaluate where you're at with your health. So, I signed up and didn't tell him I was on the board or anything like that. I just wanted to experience it. I wanted the assessment.
Yeah.
And had a nurse practitioner that came into my home, and she spent an entire hour with me,
wow.
which it's really tough to get an hour with your primary care provider, right? It's really tough to get that much time.
Right.
And she sat down with me, explained what she was going to do, and then went through a very thorough assessment and examination. We talked about everything from prescriptions to my general health status to health concerns that I have. And then everything that I talked to her about goes back to my primary care physician.
Wow.
And it just ended up being just an exceptional experience. And we actually incentivize our members by giving them a $50 gift certificate to actually have one of these.
That's amazing.
Home health
so not only is this
assessments
available to all members, but there is an incentive to take advantage of this benefit.
That's correct. And we incentivize them because we believe it's so important.
Yeah.
Because we want them to make sure that they're taking care of their health. And the earlier that we can take care of an issue, the earlier that we can identify a health issue, the better it is for that patient in the long run. Because we don't want issues where something is nagging at somebody and then they don't deal with it, and before long it becomes an acute issue. And then the cost of that goes way up, not only for the member, but for us as an organization as well. So being able to get a really good assessment and keep people healthy is right at the top of our list of things that we want to be doing.
That's such an amazing benefit. It seems like the news that catching something early or just monitoring your health early and keeping things on status quo is, I don't know that would be news to folks, that that's something they should do, but incentivizing them and really promoting that benefit is something that I think would help people take action. But I'm curious why you think or why people might wait. Why do people wait to get those assessments until perhaps it's too late, until, that pain is really bad. I need to go get it checked out, or or something worse. Why do you suppose people wait and don't take that step?
I think there's a number of factors. One may be if they are uninsured, they don't have access to care.
It's going to be too expensive if they...
Yeah, so they're just going to put it off. And we saw that with the as soon as the Affordable Care Act took place. Those first couple years of bringing in uninsured onto the plans, the claims went through the ceiling because there was all this pent up demand, right? There were all these people that hadn't had insurance for many years, and then all of a sudden they get insurance and they're going to the doctor for all these things that they haven't done for all these years, right? So if somebody's uninsured, they're probably avoiding going to the doctor. If you are insured, there's also the whole issue of deductibles, right? You got to pay your deductible, and sometimes it's easier to put stuff off and not have to pay that high deductible and things like that. So, and then I think there's just people are lazy and they procrastinate.
And they might say, maybe someday I'll schedule that appointment.
That's right.
Yeah, sure.
So one of the keys is we got to get people thinking about wellness.
Yeah.
Right. And every dollar that we spend on wellness gets paid back many, many, many times over. Yeah. Because if we can keep people healthy, if we can keep their weight down, you avoid long-term things like diabetes, obesity, all those things that have so many comorbidities that really drive somebody's health down. If we can focus on wellness up front, that pays off many times around for not only the member, but for us as an organization as well.
Yeah. Well, what an amazing benefit. What would that benefit? It was an in-home visit. Is that what it would be called?
Yeah, an in-home health assessment.
In-home health assessment. Yeah.
It was great. I didn't tell her until after the visit that I was on the board of directors.
Yeah, right. Your name didn't get flagged. Hey, this is the director here.
That's right. That's right. So it was good.
That's great. So we're getting to the part of our podcast where we ask a couple of the same questions to all of our guests. So one of the questions we usually ask our guests is, what activity or hobby do you participate in that puts you perhaps most at risk of utilizing your health insurance?
That's great. Well, I work out a lot, and I try to stay as healthy as I can. And so I love running and hiking and biking and all of those things. But I also love doing Spartan races, which can tend to be a little risky.
For those that don't know, this is the running through electrodes and up and over giant mountain walls and all sorts of things.
That's right. All these obstacles that you have to go through. Yeah. So some of them can be a little bit dangerous. So, but for me, maybe it's a little risky behavior, but there's also the benefit of just wellness, right, that we keep talking about.
Sure.
So, one of my favorite hobbies is just working out, staying in shape, being healthy, and it adds so much value to everything else that you do in life, right? I'm more active with my family. I have a new grandbaby. I want to be healthy for a long time to be able to continue to enjoy those things.
Sure.
So that's a big part of what I do.
Yeah, that's great. The co-op is so community focused. Can you talk a little bit about some of the other projects that you have in the works? I know that you're obviously on the board here. You're a member. You've got a lot of other things happening. Can you educate some of our listeners on what else Ray is doing in Montana and throughout the region?
Yeah, so I have a really significant project that I'm doing in Butte, and this is a project I've been working on for about 10 years.
Wow.
I've with the company that I have, the National Center for Healthcare Informatics, we got involved about 10 years ago in simulation-based training. So being able to simulate medical scenarios, right? So you could practice a medical scenario in a safe environment and be able to practice it over and over again until you get it right. So this is, for doctors and nurses and nurse practitioners and PAs, EMTs, first responders, for those types. We got involved in doing a bunch of this training for the military about 10 years ago. And when we started that, one of the things we recognized is if you're a rural healthcare provider here in Montana or anywhere around the country, you don't have access to simulation-based training just because it's available in so few places. They get training when they're in colleges and universities, and then only the biggest medical centers have simulation laboratories.
Yeah.
And so we saw this huge need to provide a place where rural healthcare practitioners could come and get simulation-based training, whether it's around things like emergency obstetrics or airway management, pediatric emergencies, infant emergencies, all kinds of high-risk, low-frequency things that these rural healthcare practitioners need to be ready for. Right? If you're in a small rural hospital, you might only see one emergency obstetric situation a year. Right? So
doesn't quite prepare you for that repetition. Okay, I know exactly what to do. Cue the checklist. Here we go.
Precisely. That's right. So, and without that repetition, you have skill decay, right? Mm-hmm. So we're building a facility where healthcare practitioners can come to us, and in 2 to 3 days, we can give them tons of repetitions using medical mannequins and imaging simulators, which are incredibly sophisticated.
Wow.
We can give them repetitions on emergency obstetrics, for instance, for 2 days, where they can practice all kinds of different scenarios around a complicated pregnancy, right, and delivery. And we'll do that in lots of different areas. But so we're in the process of putting together this it's a $36.5 million project. We anticipate training about 5,000 healthcare workers a year.
Wow.
At this facility.
From everywhere, they're coming here and
from all over North America.
Wow.
And we have support from all over the nation for this center. It's going to be called the Praxis Center for Innovative Learning.
Yep.
And we're super excited about it.
That's amazing.
We're just in the final processes of financing it right now, and hope to be breaking ground sometime next year.
So it's specifically designed for rural healthcare professionals?
That's correct. Yeah. We really wanted to focus in on these underserved rural providers who don't have access to this type of care. So
that's amazing.
So it's a 60,000 square foot facility, and it'll be designed to look like a mock rural hospital.
Wow.
At least a big chunk of it will,
Sure.
So it's going to be cool.
Yeah, sounds like it. That's really cool. Exciting.
So that's what keeps me busy.
That's what keeps you busy, yes. When you're not here, yeah.
That's right.
Wow, really exciting stuff. Ray, was there anything that I did not ask you that you were hoping, Kyle, I was hoping you were going to ask me this question, and here we are toward the end of the interview, and you didn't ask it yet. Anything that you can think of?
Not that I can think of, no.
Okay,
Yeah.
Okay. Well, if anybody has questions, they can leave them in the comments perhaps, and we can follow up with them later. Ray, thank you so much for joining us. This was an amazing interview. I think people are going to get a ton of value here just about the expenses of health insurance and how to get involved, and all in all, really appreciate it.
Yeah, it's a pleasure to be on your podcast, and thanks for doing this. Appreciate it.